January is Cervical Cancer Awareness Month. I do breast cancer, I know. But I thought that women's health also involves cervical health as well. So I want you ladies to also know about cervical cancer. I met these two wonderful women a few months ago, and it was just a coincidence. We talked about it, like, okay, you know what, let's tell people about cervical cancer. They'll introduce themselves, what they do, and why they're here today. And I hope you enjoy this. All right, so I'm going to leave the scene. Bye.
Hello, my name is Esther Lamtemeos, a midwife at the Cape Coast Teaching Hospital and currently at the Cervical Cancer Unit. I'm here to take you through cervical cancer prevention and its treatment. What is cancer? Cancer is an abnormal growth of cells which can occur in any part of our body. If it happens to be on your cervix, it's known as cervical cancer. How does a person acquire cervical cancer? It's gotten through a virus known as the human papilloma virus. It's a sexually transmitted infection. If you have a sexual intercourse with a person who is infected with the virus, you are likely to have the virus on your cervix. When the virus becomes persistent on your cervix, there is a possibility of you getting cervical cancer. What are some of the risk factors or people who are predisposed to getting cervical cancer? Women who have multiple sexual partners. Women whose partners have multiple partners. If you have sex at an early stage, before the age of 18, it means that you are likely to change a lot of sexual partners in the near future. Women who smoke are at risk. Women who deliver more than 5 are also predisposed. People who have conditions that suppresses their immunity, such as the HIV/AIDS, are also predisposed. Some of the signs and symptoms one can show or exhibit. One might experience intermenstrual bleeding. What I mean is that you might have your menses in January and be expecting your next menses in February. In between that period, you might be having your menses. So this, when it happens consistently for some number of times, means that you are showing signs of cervical cancer. Women who bleed within their postmenopausal age, it's also a sign. Women who have prolonged pelvic or abdominal pain. Women who experience prolonged offensive vaginal discharges. Another sign of cervical cancer is experiencing severe pain after sex, which could even be associated sometimes with bleeding. What are some of the things that one can do to prevent herself from cervical cancer? Just as we mentioned some of the risk factors, if you smoke as a woman, you have to stop. Women who have multiple sexual partners must stay faithful to their partners and, if possible, protect themselves during sexual intercourse. Women are also encouraged to use family planning methods to help them space their children and reduce the number of children they have. Here are some preventive measures. Boys and girls between the ages of 9 to 12 are to be vaccinated. This is because they are sexually naive, and when you are able to vaccinate them at this younger stage, it will help reduce they acquiring the virus in future. Also, you screen using either a pap smear test or the HPV DNA test. If you do the test using the pap smear and the results comes out to be negative, it means that you have to rescreen in 3 years' time. If you screen using the HPV DNA, you would have to rescreen in 5 years' time. And with the HPV DNA results, if it comes out to be negative, you can take a vaccine if you are below the age of 45 years. I am entreating each and every woman globally, visit any nearby facility, get screened, and know your cervical cancer status. If you are within Central Region, you can visit the Cape Coast Teaching Hospital, specifically Ward 11, and get screened. You don't need to book an appointment. You can walk in from Monday to Friday from 8 a.m. to 3 p.m. at a small cost. Thank you very much.
Hello, it's Eifu. We're from Aklina or the Norte. Me a Juma or Cape Coast Teaching Hospital. To them, my sister Okeno. Na busume oya busuma yebo oya awose anoko kram ho dewi. Yabo wa boano de Yoruba bochiche nkomo afa awose anoko kram ho. Na aseban za ya yebutum na yenye bi na za ya opopo yen ma ya chie no ho efi dame yerbe. Ozikan obi baby sede kokroman kasa oya abazi. Kokromi ya Yoruba oma nkobwo na oye no mu nyin prodo jinsem kra. Nti sadam nkobwo ya wo hena wosna no no nyin brodo jinsem wo hena wosna na ono na ye friend awose anokokram. Hena wosna no iye kona ofi ano zerban ne besia nim na eho na se ne ye no kafo zenkete ho a ye no kafo no ho nsu no otum ofa na okohena wosnim okoka ye eba ewiase afa na nyina no mbesafo bebre nara na wo hwe wono nkwa wo awozi anokokram yerebe hu nti na wa bende oto de ame na awo ye boye hu mozin na yetu awozi anokokram asifi nti ibanaze na oze awozi anokokram ozeba awozi anokokram ya za oye mpwaba wo frɛ ne human papilloma virus ono ne fantikasa eni ho aye yetwe ne short na ye frɛ no HPV demo boy no pempi na no nya fi endem egidamuzi ibanaze ono ma bes obama besia enya awozi anokokram yerebe bi ozikan mbesia ma wotani mmenyimfo bebre nda ana wonhu ne nya mpem egidamuzi otode bien mmesiama wozi mpam ekitamuzi ntam nhwe mmesiama wo hyase de wo hu benyin ntam mbesiafa wonum cigarette enna mbesiafa wo baba suremfo nhwe HIV yoruban bisu otum wonya na impempe na no yene hunam die na nkasa na hozen tumu kutia dem mboi oye HPV mboi so wo bayana wozena na ma okọ na se bibinti so wo hunam gyan entum anko entia dem mbuo no na se mbuo no tena wa wozi ano kyera obotum ababadan kokram kra nti enyama bebre wo ho a odenso anase besia ehyaase de eruma obameye hude aso de mazie erifemi obotum aye kokram Yoruba a oto awozena no ebinyi de ozikan nsu kankani bi befi wase aba na meche nsu a obefi wase aba onye nde na otuna nsu ocha ebi wo hompa a obro afi so besia no no betumatso na so de ofan besia no ne benye nya mpam nkitamuza oti yawo zunzun pa wona ya ase otibere so a besia no na ne breye sesa moja tumugun impefrimara wo mbrotinsen paado nti ibanaze na yebeye ma oboboa ma ya hweye no ho efi awoze anokokram ho a oye ne sententa ame na me 60 ye wo ha ozikan oda ye mayene mba mesiama no wo vaccine oboko asupiti wo panzi bia wozbo wo hwan na waboa abowo ho ban efi dem virus otodi bio owode mesiama ya sha sida ye ne mmenyinfo runya mpumu nkitamuze no ye ba hospital na ye behwe awoze ano hwehwemu ibio so ode ye twe ho fi mpam nkitamuze a ye ne mmenyinfo ahoro yenyi won ye ho otodi bio ode ye boye ne ma mesiama no wo ho ban efi mpam nkitamuze ntam ho afei so ode ye twe no ho efi cigarette nti etayifo dama yaka owo fante kasem dama yaka owo poto kasem ni nyina nachi no amena wo ode ye ko yetia awoze anokokram nti se wo Cape Coast ebotuma to wonwa ahwe Cape Coast Teaching Hospital oya CCTH na aba ONG ward anaso da ward 11 aba ye awoze anokokram ho hwehwemi se ni Cape Coast nso a iwianza afenne nyina no ko asupiti na koye nhwehwem efa wawoze ano ibio se eba asupiti a nyama bebree wo ho a wobeye na woza aboa aye nhwehwem wo awoze ano kokram ozikan ye bafa wawoze hu nkobwo no nsu ne bi na woza akọ wawoze mfir akwa hwehwem anaso de wozi eduro bi a wofen acetic acid beye wawoze nano na wozi enikan ahye da nsisa bi baba wawoze ne panara otodi bio wozi efri bi a wofen colposcopy wozi behwe wawoze nano na wehu nkobwo no ahye da nsisa aba nkobwo ne ma eyi nyina ye enyama a wotumbo ye na wode hwehwe awoze nano wozi boa edu kutia demi yerbe nti onua my sister my mama my nana nta ye wo ha ni aka show na aka show nua aka show sister aka show mama de wombra na womba mbaye awoze anokokram hwehwemi na amina wo nyinara yenkampom na yenkunti a awoze anokokram yeda wonasi